money can put a lot of stress on a marriage. It's one of the leading causes of divorce. And so there's a way to go about it that's healthy and respectful.
Taking the noise out of the system. It's so easy. There's so
Yeah,
many voices out there.
it's
It's
good.
so easy to get overwhelmed. When in reality, none of this is that hard or that complicated. Once you really understand a little bit better, it's really not a bad process, but it can just feel a little overwhelming.
What are some things that maybe are just quick self-assessment to questions they can ask to say, do you notice this about yourself?
Oh, 100%, right? Irritability, withdrawal from friends, right? A sense
Mm.
of detachment from your work.
For sure, if you start to see some of these signs that we're mentioning here. So then what?
And that's the part that's hard, right? That's the part that's hard. Whether we're talking about burnout or we're talking about something like clinically defined like depression or anxiety, that's where like a counselor comes in, right? Because these kinds of things, it's not easy to do.
Welcome to today's episode of the Financial MD Show. We are so excited today because we've got a much needed topic on physician wellness. We're going to talk burnout. We're going to talk health, looking at everything, including finances, but we don't want to ignore everything else that is equally important, if not more. Joining me today, as usual, my co-host, Dr. Matt Huckabee. How are you, Matt?
And great, John. I really appreciate you bringing this topic up. I host third-year medical students often. I have one right now, and we talk a lot about this topic. So I'm excited to jump into it.
Fantastic. Yeah, I'm excited. And especially to hear your perspective through your eyes, the eyes of your specialty. For those of you that don't know, Matt is a practicing psychiatrist, and we get to hear wellness for people in general. And then you get the view of him being a physician. And then us at Financial MD are getting to sit down with residents, sit down with young attendings, the couples, talk marriage stuff, talk parenting, kids, self-care, all those other kind of things that go with it. Get to witness the stress and emotional uprising that comes from talking about a tough concept like finances, and we do all day long. So all sorts of interesting stories we've seen here over the last 10 years of just trying to push people to talk about money and make some tough decisions. All that really plays into this. So, Matt, I'll let you kind of start with where do you feel like we need to start when talking about this topic of physician wellness at especially this phase in the career, deep into
Sure.
training or starting to come out into attending? Where do we start with that? What's to think about?
John, it's a space and it's really broad and it's hard to kind of focus in on one particular aspect. Obviously we can talk about physical wellness, we can talk about financial wellness, and all these things are really, really important. Now, this is a financial show, so we're going to spend some time focusing on that. But, this is a time of transition in medicine. We got a lot of new med students coming in, we got a lot of new residents, a lot of new attendings transitioning. So this is a big time of transition. So I do a lot of mentorship around this time. And I have a student right now and he's on his first rotation of third year, and that's when you're first in your clinicals. And that can be a really challenging time. You're coming out of the classroom, you're getting into the broader part of your training. And same kind of thing when you leave residency and you're starting into your jobs and attending. These are big transitions. And,
Mm-hmm.
folks need to make sure that they take care of themselves, number one, because, we use this analogy, or I use this analogy with my patients. Like when you're on the airplane, and they're doing their little spiel about the exits and the seat belts, right? And the masks drop down. They tell you, put your own mask on first before assisting others, right? You
Yep.
got to be good to yourself before you can be good to your spouse, your kids, your patients. This stuff trickles downhill. So if you're not taking care of yourself, well, then it's hard to take care of others.
Yeah, that's totally true. And we see that affect so many different things. And it's not the kind of thing we say this about personal finance as well, is that you probably see this in health. It becomes this ostrich effect almost where they'd rather just kind of stick their head in the sand and say, I'm doing okay, I'll be fine, whatever. I mean, what are some common responses you see to that? What are people's natural reaction when they're so busy with what they have to get done? They're physicians, they're driven as med students or residents. It's just like drive and push through and suck it up. Do you see that a lot?
No, I think that's changing. I mean, we still see that to some degree. I
Hmm.
think mental health and wellness are kind of lumped together in this sort of stigmatized world that we live in. That's changing somewhat. I think the
Okay.
younger generation is much more apt to talk about it than others. Now, of course, this may be specialty dependent, right? I'm a psychiatrist. I talk about wellness and health, and I tell the students, take some time for your mental health in the rotation and things like that. And that may be biased because of me. I don't know if a surgeon is telling their students to do the same kind of thing, but it's changing over time. We're more open to talk about stuff like that than we used to be,
Hmm.
but we got a long way to go as a society in general, right? And in medicine, I
Sure.
think there's this culture in medicine where we don't really talk about our problems. We don't always reach out for help, and that's
Yep.
often to our detriment. There's a lot of docs out there that struggle in silence as a result of that stigma. And so my hope is that's changing, and whether that's like something as big as like substance abuse or something like that, or even just, hey, I'm burned out, or maybe I'm feeling, stressed out about this one case that I had or something like that.
Yeah.
So sometimes it's really important just to reach out to, friends and colleagues in that early phase when you just feel those first things. And I do think that's changing somewhat, but like I said, I think we got a long way to go.
No, agreed. I would say I've observed from this end some of the same things, more openness to that, getting treatment for different mental health things, no matter how big or small, anxiety, depression, what the mental health field would label adjustment disorder, and situational things. And honestly, we see that we help a lot of residents and young attendings get disability insurance, and that comes up in underwriting is mental health. They want to see what medications they're taking. They want to know, have you seen any mental health professionals? And that's a big deal. So I think if number one, we can start to stress that this is important. And if we just look at data, we've seen a lot of disability insurance underwriting situations, outcomes, decisions, and to see how much stress and influence that disability insurance companies put on mental health, like they don't mess around with it. I mean, we have seen residents and young attendings declined for disability insurance for mental health issues, probably more than anything else, to be honest.
Yeah.
Yeah, it kind of shocked me and surprised me. And I think it's because the effects of it can be so broad, and I don't know what's the medical term for that, of like when something just has so many different possible affecting every other system in your life. You know what I mean? Like,
It hits in all domains for sure. I mean,
yeah,
occupational, it can hit at home. I mean, absolutely. When I'm filling out disability paperwork for a patient, they often
yeah,
ask me to assess, right? How does their depression impact X, Y, and Z? It's really hard, right? It's really hard because you're
yep,
right. There is this like really broad impact, and that's just depression, forget anxiety or,
mm-hmm,
bipolar or something like that, right?
yeah,
So there
yeah,
is a really, or there can be a really wide ranging impact from some of these diseases that makes it challenging. Now it's totally livable and totally, totally doable, but
mm-hmm,
yeah, it can be tough to kind of assess what kind of an impact that might have. Yeah.
yeah. If one of our listeners is not there yet, not at a place where they would consider it a mental health disorder or anything, but just like, yeah, I'm stressed, maybe feeling some of what you could call burnout. It's where do we start? What are some of the preventative maintenance things? Where do you, if you're sitting in front of a bunch of med students or you're talking to your third year med student, like, how do you start that process or evaluation or self-assessment, let's say, because everyone listening to this is trying to learn some stuff they can do themselves. Where do you start with that?
It's a great question. There's been a lot of research on this field, right? And there's some scales and things that are out there.
Okay.
Hit or miss, right, in your experience. I mean, I think honestly the big key in these kinds of things is at least in my experience. Now, this
Mm-hmm.
is just me and my life, but having peers, having friends, having classmates to reach out to, especially if it's work related, right? If we're talking like for
Yeah.
focusing in on like medical burnout, stress, that kind of thing, not talking about like at home and stuff like that.
Yep.
Having somebody to process that stuff with is really important. Now, the ACGME, that's the group that runs all the medical education in the country. They've gotten better about adding modules and trainings and things like that, right? But I don't know about the full spectrum of your listeners, but we get a lot of modules, we get a lot of online trainings and
Yeah.
things like that. And so there's a big tendency for these kinds of things to kind of be glossed over. And I hate to say
Yeah.
that, but
I
that's
can
just the
picture
truth.
that. No, it's
That's
true.
just
I
the
mean,
truth, right? And so my advice first is, especially if you're in training, if you're a medical student or a resident, then you need to reach out to either a trusted resident or a trusted faculty member to start
mm-hmm.
with. That is absolutely the first place to start, because particularly in residency, there are lots of mechanisms in place to make sure that stuff gets handled. That's the first step, is making sure. Now, of course, every residency is going to be different, and I'm well aware that there is a full spectrum of acceptance of that kind of thing within residencies,
Yeah.
right? I mean, some surgical residencies, for example, aren't going to be as tolerant of that kind of thing. Unfortunately, that's just kind of the medical culture that's, evolved for a long time. But, I do think these are things that breed, and they kind of compound on each other. So if you're even feeling like, hey, maybe this is something that I should think about, or I should start talking to
Hmm.
somebody about, I'd encourage you to do that, because it often doesn't get better by itself.
Yeah, no, that's good. You mentioned there's so much that the ACA GME has started to put out and recognizes with that. But I think it becomes this problem, and we see this in the financial world as well, is there's too much information, so they don't do anything. It's out there. Like you said, research has been done. There's modules that have put out. You can find YouTube videos. There's training. There's just so much stuff. There's no lack of resources. We're probably drowning in information, but we're starving for execution. And I see that with everything. This is no exception, that there is so much help out there and resources available. But what's that point where somebody sits down and says, okay, it's affecting me enough that I have to do something and learn about it? And unfortunately, a lot of times that's, I wouldn't say too late, but definitely later than it needs to be.
It's hard to say. I think it would probably be different for every person, to be honest with you.
Yeah,
I don't necessarily know if there's one sort of line in the sand that you could say is like, hey, this is
sure.
where we need to, have an intervention or whatever. But yeah, I think it's kind of different for everyone. And I think, to your point about this mass amount of information, this amount of resources, I think you're right. And what I often tell folks is medical school and residency is an extremely busy time.
Mm-hmm.
Obviously some rotations are going to be more busy than others, but I tell my patients this too: start somewhere,
Yep.
right? Start with one small thing and go from there. So even if
Yep.
it's, a 20-minute jog, whatever it is, you
Okay.
can find time, even on those busy rotations, to do
Mm-hmm.
something for yourself.
Yep.
Now, some people it's music, some people it's cooking, some people it's whatever, but you got to start somewhere. And then that being said, too, not one tool is going to be good for every specific situation, right? And so I often tell people, I tell patients, right, load yourself up with three or four. When Batman's got his belt, he doesn't have just
Mm-hmm.
one tool, right? It's not always
Okay.
the boomerang or the grappling hook or whatever, right? There's
Yeah.
a specific tool for a specific circumstance. So I think having a few different de-stressing techniques, or whatever they are, whether that's meditation, whether that's,
Yeah.
you know having a beer with a buddy, that, one of those may not be the best for each situation. So having a few
Yep.
different ways you can de-stress and start somewhere, because if
Yeah.
you keep it bottled up, that's when there's trouble. So,
Okay. So that's the question. So let's say we're at the very early stage and somebody says, I don't necessarily think I have a problem or am at that point, but I am interested enough to figure it out. Is there some tools to that point or self assessment where they can start to kind of just get a quick measurement to,
yeah, and
questionnaire
I
to
don't
say
I
I am?
apologize. I don't have the exact scale off the top of my head, but there are validated screening tools for burnout that you can
Okay.
find for free on the internet.
Mm-hmm.
I'm blanking on the acronym right now, of
No,
course, but
we'll post some
um,
stuff in the show notes. We'll do some research afterwards to
absolutely,
pull
I
up the
can
links
get you
for it.
those. And so, and that could just even be, it's for those in sort of the mental health world, right? We have
Yeah.
the GAD-7, that's a screener for anxiety. We have the
Okay.
PHQ-9, which is a screener for depression. It's the same
Yep.
kind of thing, right? A
Yeah.
series of questions that answer,
Okay.
that have been validated for burnout, and it's really helpful. And so, folks can use that to sort of at least start the process. Like, hey, is this something
Mhm.
that we're ranking high and this is something that I need to really pursue, or is this kind of just the early phases?
Yep. No, that's good. What are some signs? And let's say they don't do the assessment or they do whatever. What are some things that maybe are just quick self assessment to questions they can ask to say, do you notice this about yourself? What are
Yeah,
some
I
things that
mean,
you feel like if people notice, they should
oh,
do something?
100%, right? Irritability,
Okay.
withdraw from friends, right?
Okay.
And these are, and to be fair, these are nebulous in terms of, say, maybe looking a little bit like depression or anxiety or things
Yeah.
like that. But certainly, a lack of empathy, a
Okay.
lack of empathy for your work, a sense of
Mm,
detachment from your work, certainly social withdrawal,
yeah.
irritability, that sense of, hey, I'd rather be anywhere than work, the
Mm,
Sunday scaries. I know it doesn't apply necessarily to medicine, but those are
sure.
all things to be watchful for, right? I
Yeah.
mean, we got into this job because of passion. I mean, you don't give up as much as you give up to get into medicine without having at least some degree of passion for the work.
Yeah.
But then you get into it, you're in medical school, you're in residency, right? And it's a grind. And so
Yep.
everybody understands that. And so it can wear on anybody. So that sense of detachment ebbs and flows, right? But certainly that in concert with some of those other things, needing a drink, needing an alcoholic beverage to unwind after every single shift, all kinds of things. But those are certain sort of the yellow flags that I would say to be kind of mindful for.
Okay. Gotcha. So if somebody noticed that they just weren't that interested in their work anymore on a regular basis, that would be a sign that maybe take a deeper look at some of their emotional well-being, mental health, that kind of thing.
Mm-hmm.
Okay. Withdrawing from friends, family, just kind of, would you say just a general kind of just don't seem to be interested in anything, type of dysthymic type of?
Yeah, certainly not socializing with friends, that kind of thing. So I apologize. I'm just Googling it as we speak. It's the
Yep.
Oldenburg Burnout Inventory,
Ah,
OLBI.
great.
It's a 16-item scale, right?
Okay.
And there are 8 items
Simple
related
enough.
to exhaustion, physical fatigue, cognitive fatigue, that kind of
Hmm.
thing. And then there are 8 items related to sort of disengagement, sort of your sense of degree of distance from your work,
Okay.
negative attitudes towards the work, that sort of thing.
Yep.
So.
Yeah. Great. Okay. So we'll put this in the show notes as well so people can link directly to it. So we start with trying to figure out, hey, if you're interested at all, take this assessment. For sure, if you start to see some of these signs that we're mentioning here. So then what? So you take this assessment. It helps you to figure out that, yeah, you might be looking at some burnout and some things that you might need to look at. Then what? What do you do next?
Well, it's tough. The easy answer, right, is to get some time off, right? But now we all
Ah,
know that that's not the easiest thing to come by in
yeah.
residency or in medical
Yeah.
school. So that might even just be, something as taking yourself when you are off work, taking yourself completely away from the work,
Mm,
taking getaway time. But that's the hard part about this, right? Is because we're
yeah.
talking about a period of time when people are really in a pipeline of medical training, and so taking
Yeah.
time off or taking breaks is often a big challenge. And so that's, I think, where some of these, the tendency to engage with these modules and, wellness and exercise and all these kinds of things. And those are all good, but it's a
Yeah.
really tough thing to solve. And some people do. To be fair, when I was in residency, we had a resident take a month off. And so it's dependent on the residency, but these kinds of things are doable. I think, the logic behind it would be sort of we'd rather have you take time off and extend your time than hurt somebody or something
Yeah.
like that. But
Or then
of
completely walk away from medicine
of
or,
course,
we see
right? Of
that.
course.
Yeah.
Yeah, but these are often hard things to solve. And so, it kind of depends on the degree of it. Early
Yeah.
stages, as I said, can be something as much as finding those positive coping skills and, kind of like the old-timey balances, right? You need to
Mhm.
have a lot weighing down on the sort of stress side. So
Yeah.
we need to add some more positive things to balance that out, whether that's
Okay.
time with friends, time away from work that's completely detached from work,
Yep.
those kinds of things, exercise routine, better diet, those kinds of things, versus like a little bit higher on the burnout scale. And, that's professional counseling and
Hmm.
potentially psychiatric intervention. All of that is part of that spectrum.
Do you find often just that first step of time off, time away really helps and can make a difference there?
It varies. To
Yeah.
be honest with you, it does vary. It's person to person. It kind of depends how early we catch it.
Yep.
In later stages and or in further career, like when I'm talking about later attendings and things like that, that's harder. That's a little bit harder to sort of recover back from. So not always, to be fair.
So you've taken time off, it helps or it doesn't. You then try to find some competent help through counselor, psychologist, psychiatrist, whatever you got access to. And everybody has this question on their mind. Do you find that medication is important or necessary here, sometimes helpful? How would you describe that?
In my personal practice, I'll tell you my general approach when I'm looking at whatever diagnosis it is
Yep.
what is the functional impact. And so there'll be times when I might be doing an intake assessment on someone and they might meet X number of criteria for, say,
Hmm.
PTSD, for example. They don't meet quite enough to make the diagnosis stamped in stone, right? But
Yep.
I'm pretty sure that this is the diagnosis. They're meeting most of the criteria. You know what? But they can't go to work because of their anxiety, or they can't go to the grocery store because of their anxiety. So am I held back by the fact that I can't stamp in stone that diagnosis? No, we're going to treat it because there's a dysfunction,
Yep.
right? So the sense is kind of what's the long, like how long have the symptoms been around, and how are they impacting the patient's life? And medicine's not forever. If you're on medicine for a little bit, you take some of these other steps we've been talking about, you can come off of it. Absolutely. But if there's a high degree of symptom burden or lifestyle
Yeah.
burden, then I think, medication is certainly something to be considered.
Sure. And we see that. And again, we help residents through the disability insurance application process. So we see this in terms of we get the insurance company comes back to us and says, hey, we noticed on their prescription record it said, who knows, I don't know, what's a common anxiety medication. And they'll say, what was this for? And we got to pass that on to the
Gotcha.
resident. And they'll say, oh, I just took it for 18 months during residency. I was going through this really stressful time, blah, blah, blah. I don't take it anymore. But, that is so common. But, to your point, it's like they took it for a time and it's been 2 or 3 years since they took it. They don't need anymore. There was just a time when they needed a little bit of a boost and assistance, and great. But that's so to maybe destigmatize it a little, that's pretty common. And obviously you see that in your practice. We see that in terms of the health and underwriting medical records history. It's pretty common, and isn't a deal killer in terms of if somebody has to get their disability insurance, for example, that if they explain it well and just say, hey, I took this for a time because it was just stressful residency, underwriters usually get it and not a big deal.
That's good to hear for sure.
Yeah, man, it's gosh, how many stories of just seriously, like I try to sit down and ask some preliminary questions before residents fill out a disability insurance application, like you taken any medication in the last 2 years, have you had any seen a psychologist, therapist, anything. This is a common one that maybe gets asked, whether physician or not. But if somebody asks you, like, okay, I can see a counselor, an LPC, I can see a psychologist, a psychiatrist. Like most people, the layperson's like, what's the difference? I don't know. Like, how do you differentiate that for people and give them direction on where to go?
Yeah, great question. The first sort of fork in the road is psychology versus psychiatry.
Sure.
So psychiatry is a medical subspecialty.
Mm-hmm.
Psychiatrists go to medical school, obviously, and do a residency in psychiatry. Now, in part of your residency, you're trained in some psychotherapies in order to prescribe psychiatric medication. Some states are trying to change that with PhD level psychologists or pharmacists or things, but neither here nor there. For the most part, right? Psychiatrists, medical school, psychologists, that can either be like a PhD psychologist, or any other people in the field, for example, social workers, et cetera, like you mentioned, that
Yep.
that solely do psychotherapy. And so, for the most part, in the way things work these days, those folks are doing most of the, like, say, week to week psychotherapy type sessions, and the
Yep.
psychiatrists are just medicine management type stuff. Most of my clients now, that's anxiety, depression, bipolar, what have you. They're in both, right?
Okay.
For the burnout folks that we're kind of talking about, I would say the lion's share are not going to rise to the level of needing a psychiatrist or needing a
Mm-hmm.
specialist in mental health. For the most part, if they do need medicines, the primary care physician is usually adept at using the SSRIs, number
Mm-hmm.
one. And number two,
Okay.
they may just not need medications. And so, which is a good thing, right? Because most of them can do just fine with psychotherapy or talk
Yep.
therapy, whether that's like a counselor or a social worker, what have you. There's also a lot more access, right? For the
Okay.
most part.
What comes to mind for me, and this is my background there at a time I was an LPC. I have a master's in counseling, so I know some of this stuff. Cognitive behavioral therapy. Do you find that's a common resource for this type of management with when it comes to seeing a therapist and that kind of thing?
Yeah, definitely. I mean, I
Okay.
think I might step on toes by saying this, but I would venture to say that most therapists in the country nowadays are doing CBT or
Hmm.
which is cognitive behavioral therapy or
I would
variants of
agree.
it. We don't
Yep.
have a lot of psychodynamic stuff going on anymore. There's certain places, of
Yeah.
course, but for the most part, for the lion's share of complaints, we're doing some variants of CBT. So absolutely, this kind of stuff is super helpful. Of course, there's a full range of implementation of that, but
Yeah, and we get, let's say if someone wants a little more lay explanation of CBT, I explain cognitive behavioral therapy like training you in skills that you may not know how in terms of reframing thoughts, just managing the thoughts and feelings inside to just learning skills.
I tell people, and particularly when I talk about DBT, which is dialectical behavioral therapy, I
Yep.
know that's different, but that is an emotional regulation skill teaching tool,
Yep.
basically at its core, and it's phenomenal for lots of different things. If you Google it, of
For
course, you're going to get the borderline
PTSD
thing right
and
up front. But I tell folks, from an emotional regulation standpoint, it really builds a lot of good skills. CBT, the way I teach it, I tell folks, right, we all have our thoughts, right? We all have our
mm-hmm,
thoughts that occur in our brain, and we
yep.
all have our feelings.
Mm-hmm.
And sometimes the way that our thoughts influence our feelings can be kind of automatic. Over
Yeah.
time, thoughts reoccur and reoccur and
Yep.
reoccur. And so they influence, and so you hear this phrase automatic thoughts. That's what's talking about, right? It's a
Yep.
it's a well-worn path that our brain does that influences so that thoughts can influence the feelings. I think that I'm worthless, and then I feel sad, for example, right? Well,
Yes.
the other sort of, if you picture a triangle, the other sort of point on the triangle is actions, right? And so
Yep.
what we found, right, is that there's a reciprocal relationship between how we think, how we act, and how we feel. I'm sorry, I got the
Absolutely.
other way.
Love that.
And so all three of those are reciprocally integrated. And so if you think a certain way, you will feel and act a certain way. If you act a
Mm-hmm.
certain way, you will think and you will feel a certain way, etc. Right?
Yeah.
So the way I tell folks is if you think about cognitive behavioral, cognitive being thoughts, behavioral being actions, right? That's kind of where the name comes from. And so when we're making an intervention, what we're doing is we're intervening on one of those axes, right? And so there's a variant called behavioral therapy, which is just focused on the actions, but cognitive behavioral therapy really focuses on all three. And when you talk about reframing, that's of course reframing some of the way that we think and undoing that automatic thought process that develops. So again,
Okay.
high level stuff, a very
Yeah.
top level of explanation of CBT, but that's how I teach it to patients, and we're kind of undoing those automatic relationships that happen between the triangles. So
Okay. So what's a common thought, action, feeling that may come when it comes to burnout or physician wellness? Like somebody's feeling that burnout effects, like what are some common thoughts and feelings associated with that type of situation?
oh, just off the top of my head, right? Like I think I did a bad job with that patient,
Okay. Yep.
right? So then I might feel like, and this is a little bit of thought feeling gray zone, right? But I think I did a bad job with that patient, so I feel bad about it. So I act differently for the next patient,
Yeah.
right? And it's a
Yep.
very simple explanation, but you could argue, like if we're talking about depression, right?
Mhm.
I think I'm worthless, so I feel sad, so I'm going to sit on the couch, whatever, right?
Yep.
You could see how, and then of course, if I'm sitting on the couch more, or if I'm changing my behavior with that patient, right, then
Yes.
that might reinforce the thought that I had, right? The thought that I did a bad job, right? Oh, I changed how I managed the next patient, and something went bad, and so therefore I am thinking more that I'm a bad resident, and therefore, so you could see easily how over time this path gets reinforced and you get this downward spiral, right?
The action part of it, like, is what you talked about before, the retreating from friends, the just, lack of desire and motivation, like not doing anything. That's like the action side of stuff, right? That's how it comes out and manifests action wise. But even if we take that action piece out and we keep the thoughts and feelings and just say, even if we're just focusing on thoughts and feelings, that can be a problem. There could be a point where I just don't like feeling this way all the time. And I need to change my thoughts so I don't feel this way.
Yeah, and that's the part that's hard, right? That's the part that's hard. Whether we're talking about burnout or we're talking about something like clinically defined like depression or anxiety, that's where like a counselor comes in, right? Because these kinds of things, yeah, it's not easy to do. There are
Yeah, we're not
workbooks, there
born
are
knowing how to
courses.
do this.
Right. This is changing and developing enough outside perspective on that process that's happening subconsciously within inside you
Yep.
is really hard, right? And so that's where having an outside perspective that you see on a regular basis to kind of probe the depths of that relationship is really important
Yep.
because oftentimes we can't see it ourselves.
Yep. No, and I think that's good where the assessment tool comes in. and just say, yeah, something doesn't feel right or doesn't seem right. I need something to
Yeah.
help me assess where I'm at. And then,
Definitely. And, to shift, we're talking a lot about burnout, to shift towards wellness, right? Sort of the antithesis of burnout, right? Being
yep,
wellness is focusing on a lot of these things. And to
yep,
get to like think about the topic of the podcast and like financial wellness, we
hmm
talked about like mentoring couples and new attendings and things like that, financial disagreements or financial mismatch in a
yeah.
couple is like a huge
Oh, yeah.
indicator for divorce, right? And it's one of the
Yep,
main reasons people get divorced in this country. So not to
yep,
segue too hard, but I think that it's all kind of interrelated, right? Because if
yep,
again, you got to take care of yourself and then all the things that come along with it. Because obviously we try to, separate work and home, right? But like you're a person and you exist in all of these places. And so your home life is super important for your work life and vice versa. Because if you're burned out, you're going to take that home. If you're struggling with your money and relationship at home, you're going to take that to work. And so it's
yep,
all interrelated.
yeah. No, definitely. And I would say if we were to pick out some key tactics or action items for, let's say, just finances, I think the first feeling that we tend to get when we sit down with a resident and they want to talk finances, and that's really all that has to start. So we'll do a lecture, dinner, whatever, and then they want to schedule a consultation to talk about finances. It often starts with, I'm overwhelmed. I know I need to do something. I don't know what, or I don't know that I can or have the time or capacity or wherewithal to do it. I just feel this pressure like I need to do something. And we say, okay, let's just, we always start with this, tell me what you're doing well. And I know it sounds scripted, but it truly helps to say, focus on the positive. Everybody's doing something well, as weird or innocuous or hard to find as it might be. Everybody's doing something well. And so then we tend to focus on, okay, let's clear out what we can't control and just focus on what we can control. Just that alone can help to alleviate some of the overwhelmed feeling and say, okay, what are some of the biggest hurdles or stressors for you? I just feel disorganized. Okay, let's start instituting some actions, baby steps to help you get organized. And the beauty of where we are today in history is that there's so much technology and automation and apps to help you get organized. We look at Mint's not around anymore, but You Need a Budget is an app. Monarch's a good one. Rocket Money. We've got links for these all over the places, and we'll put some more in the show notes. But just to say, okay, start with this, link your accounts to get an idea. Okay, first, where's your money going?
Mm-hmm.
And that can be a great place to start. Just that alone will help you feel like, okay, I'm getting on the path to being more organized. That action then creates a thought that says, hey, I'm starting to improve. That creates a feeling of positive feelings of some kind of, self-improvement, feeling good about yourself, etc. So just those steps alone can help a ton. And to your point of what about a couple that's never really even talked about finances? Because I can't tell you how many times we sit down and ask some of our list of questions or go through our values staircase and just start asking questions. When I ask one of a couple, hey, what's important to you about money? And they think, no one's ever asked me that before. And then they start to answer things, and the spouse looks at them and goes, really? I didn't know that was important to you. Or so many times I get the phrase, well, I've never really shared this, or, we've never really discussed this before. That honestly, that's the part that I love about what we do. And when we bring up the concept of finances and personal finance, so, okay, this stuff, does it need to be talked about? I mean, at some point, but the earlier we talk about it, the better, of helping a couple to figure out, okay, are we on the same page with some stuff, different page with other things? You don't have to be on the same page with everything. You just have to start with being aware of where each other is and how you operate and how you tick. We talk about some people are naturally spenders, some people are naturally savers. I'm guessing Matt Huckabee is more naturally a saver. Just born to.
I'm a reformed saver in my
Okay.
later years, but yeah, no,
Yep.
and I think you're absolutely right. And I think it's kind of like the old Alice in Wonderland. Well, which way do I go? Where do you want to go? Well, I don't know. Well, then it doesn't matter, right? So you
Anyway,
need
we're
to know
taking
where
there.
you
Yeah.
are. You need to know where you are. Then you need to know where you're going, and then you can make a plan to get there, right? It's like
Yep.
any kind of. It's kind of nobody operates I mean, with some exceptions, right? Nobody operates without a plan, right?
Mm-hmm.
You kind of know what you want to fix, and then you make the plan, and then So I think the same thing is true for our money, right? So to
Absolutely.
your point, there's this tendency to like freak out. I have to invest. Well, what about investing? What about it? It's
Mm-hmm.
like take a breath. Like let's just get a stable, take look at where your accounts are right now. Where's your money
Yep.
going? That kind of thing. Okay, you want to do this in the future? Okay, well then here's how we get there. The line we draw between 2 points, right? So yeah, the first step is often, taking the noise out of the system. It's so easy. There's so
Yeah,
many voices out there.
it's
It's
good.
so easy to get overwhelmed. When in reality, none of this is that hard or that complicated. Once you really understand a little bit better, it's really not a bad process, but it can just feel a little overwhelming. But so did medicine, right? Like if you're a
Oh
resident
yeah.
or you're an
Oh my
attending,
gosh.
when you were a med student, you didn't know your way around anything. And
Yep.
and it's a little bit like learning a different language, kind of like medicine is, but it's something that you work at and you can do too. So
No, that's good. And I think that gives our listeners some action items, whether it's action items in terms of burnout, action items in terms of their finances. We want to make sure with every one of these episodes that we're giving you some actionable things you can assess in yourself and start to take action on. And maybe that first thing is you sit down with your spouse and say, hey, let's just talk about goals for a minute. Like, where do you see us financially 30, 40, 50 years? How long do you really want to work? What does financial independence mean to you? What, like asking some of these questions. And we can help with that. Our consultation's always free. If you want to just, hey, I want a third party to sit down with me and my spouse and just ask some of these questions, no problem. You don't have to use our services. Just happy to have that conversation with you and ask some of those key questions that, frankly, as Matt talked about, money can put a lot of stress on a marriage. It's one of the leading causes of divorce. And so there's a way to go about it that's healthy and respectful. When we have our lectures and talk about this topic, we always say, hey, when you sit down for the first time to talk finances, your number one goal should be respect and love. And I say both of those things. And if you can handle a conversation with love and respect, then the conversation will go fine. And you'll feel better because of it. You'll start to feel like you're making some headway in your finances. And that alone can be a huge first step that most couples don't take. So just that alone will put you ahead of, I'm sure, 50% or more of the population.
it's a great idea. Yeah, and I don't know if you want me to speak about kind of
Yeah.
what our plan is for maybe the next few
Yeah, let's
episodes.
do it.
Just so for our listeners, this is something that we're pretty excited about, and I think one of the key things to hit home with this message is it doesn't matter where you are in your training. You could be out in attending hood, or you could be a brand new incoming first year medical student, or anywhere in between. One of our really big points is that at any point in here, you can make changes and you can set things on a path that are going to set you up, for greatness in the future. There's
Yes.
this tendency among med students or among residents, like, oh, these numbers aren't there. I'm in debt. I've all got all these things going on, but there are steps you can take and that can put you on a really awesome path. And that's one of our goals. And so over the next few
Mhm.
episodes, John and I are going to be introducing sort of a series of steps.
Yeah. And that's the idea, to help you not feel overwhelmed, but just have you take one bite at a time.
The idea behind it is that when your money comes in, we want to be able to sort of say, hey, this is first, second, third, fourth, fifth, sixth things you want to think about. So we're going to
Yep.
kind of present an outline over the next few episodes and kind of delve into each of those steps in a little bit of more detail. And the hopes is kind of give you a roadmap, right? A first few steps that you can take at any phase in your career. These are the kinds of things you should be thinking about. Some may apply to you, some may you've already mastered, and that's great. But our hope is to kind of give you that roadmap, that one foot in front of the other type of thing, and put you on a better path.
Awesome. Yeah. So you'll be hearing about that. If you want to hear as soon as that comes out, then you'll want to make sure you obviously follow this show on any of your podcast platforms. Follow us on Instagram, TikTok, Facebook, and YouTube. Those will be the places where we will send out these announcements. And then, of course, go to financialmd.com, join the email list, because in addition to that announcement, any of the resources, our articles, timely things will be sent out there as well. So there's no shortage of places to know. Lastly, remember that there is the Financial MD community. It's our Facebook group for physicians only, by physicians, to talk about all things personal finance with doctors. And we're posting a lot of these things and resources there as well. So No shortage of places to go. We'll get this out to you in the next couple of weeks. We're excited to start giving you some actionable things and just in bite-sized pieces. My dad used to always say, how do you eat an elephant? One bite at a time. Same thing with how do you get on track financially? One bite at a time. And we'll help you do that. So stay tuned here to the Financial MD show. We will get you what you need to know and nothing more, maybe a little bit more just from our bantering and stories, but you'll definitely get what you need to know. And until next time, this is Jon and Matt signing off on the Financial MD show. We will see you next time.